If you've ever wondered whether investing in advanced technology, like something like laser therapy, could really transform your clinic, both in terms of patient outcomes and business performance, then this episode is a must listen. I'm joined by Dr. Stephen Barabas, Medical Director of K-Laser UK and VBS Medical, to demystify what laser therapy actually does, share the real-world results clinics are seeing, and tackle the big question that is out there: is it worth the investment? We talk clinical impact, return on investment, marketing tips, and what the future of laser therapy and using medical devices in your clinic looks like in the health and wellness industry. So whether you are laser curious or whether you are maybe already ready to take the leap, this conversation is going to give you real insights into what you need to know to make a really informed decision. Welcome to the Treat Your Business podcast with Katie Bell. I'm Katie, and this is the place where clinic owners like you learn the strategies, tools, and mindset shifts needed to transform your clinic into a thriving business, one that gives you more time, more money, and more freedom. Born from a passion to challenge the idea that average is normal, we empower clinic owners to create extraordinary businesses, incomes, and lives. Through our world-class coaching programs, we help you step out of overwhelm and into confidence, turning your clinic into a business that fuels your lifestyle, not draining it. So, are you ready? Let's dive in. Today's episode is sponsored by VBS Medical Ltd. It's the exclusive distributor of K-Laser therapy and Indiba radiofrequency therapy in the UK and Ireland. K-Laser and Indiba are non-invasive therapies that enhance and accelerate the healing process, complementing standard of care, broadening therapeutic opportunities, improving clinical outcomes, generating new profit, and distinguishing your clinic from the competition. K-Laser and Indiba have a medical device regulation approval, meaning they have scientific publications to validate their clinical applications in practice. To learn more, visit www.vbsmedical.com and book your free trial today. Dr. Stephen, welcome to the Treat Your Business podcast.
Very glad to be here, Katie, and I've been looking forward to this.
Yeah, me too. And our listeners will be very much looking forward to hearing it from an expert's voice, I think, is the most important thing on this podcast for me. Dr. Stephen, before we dive in, just give everybody a brief kind of who you are, what it is that you do, and what you're going to be talking about today.
I'm actually a veterinary surgeon. So my doctor is a veterinary doctor, but I have been working in the medical field for the last 15 years. And maybe or maybe not the audience knows that actually vets, unlike doctors, can treat humans and animals. Not that I do a lot of hands-on treating these days, but I got involved with medical devices, having been a director of a big pharmaceutical called MSD. And so I came from it from a background of needing science. And also I've always, whether it was in practice or in working as a director in a pharmaceutical company, I was always interested in pain management and in rehabilitation. When I came back and lived in the UK, that's when I started up, first of all, VBS Director, which is my veterinary company, and then VBS Medical, both of which work on cutting edge devices and supplementation for the highest level of rehabilitation and pain management. So that's been my interest for most of my life, really.
Wow. How do you split your time at the moment then, Dr. Stephen? Do you still hands-on with the dogs and the cats and the animals, or?
I'm speaking actually from a medical clinic that I set up as a training center. So I have a training center and a therapeutic clinic where I have 2 sports therapists, an osteopath, a podiatrist, and some aesthetic doctors. So we have a whole range of modalities that we use here. But to keep my clinical skills going on the veterinary side, I work 1 in 2 weekends as a vet. It allows me to go and remain a little bit real and understand the challenges of dealing with patients. But also, I've always loved the omnicompetence of being a veterinarian, where you're a diagnostician, you're a clinician, and you do treatments, and you can do all of it in one day, which is quite special. And I'm trying to bring a little bit of that into the human side, because I get frustrated by being sent somewhere for bloods and being sent somewhere else to do this and sent somewhere else to do that. And so I've spent the last year gilding a group of individuals together with the equipment that we have to hopefully do a little bit of what I do in veterinary medicine and make maybe the medical side a little bit better.
It's amazing. And I was in the vets only last week with my dog for his annual checkup and vaccinations. And I was sat in the waiting room, and it's funny, isn't it, how now we've built a relationship and I see your stuff more and more. And there was a big poster in reception about K-Laser, what it can do for dogs. I was like, oh my goodness. And that's probably been there for ages, and I've just never seen it before.
Yeah, it was fun. It was through the veterinary that I got involved with K-Laser. So we were, outside the USA, the only country in the world that was using K-Laser for the veterinary. The rest of the 72 countries were only doing human side. But despite the fact that I had loved the science and I loved what they were doing, there's nothing better from a clinician point of view to see it physically in your own hands. And an animal doesn't do placebo. So yeah, I came on board for K-Laser because they almost had pharmaceutical grade scientific data to show the safety and the efficacy. But there's nothing like seeing it in your own hands. And a dog with osteoarthritis of the hips doesn't do placebo. It's going to walk better, or it's not going to walk better. It's not doing it to please you. Or a wound which you're expecting to heal over 2 weeks heals in less than 3 days. Those things can't be done without physically seeing it being done in front of you. So that's why I started in the veterinary side. And we've got about 500 clinics in the UK using K-Laser. And it's become really the gold standard in regards to veterinary. In the human side, we started a little bit late, as I said, because I wasn't quite so confident starting in there, but the rest of the world was doing great guns in that area. And then I brought that in, and that's where we've built both in the manual therapy, osteo, chiro, physio, but also a big area has been podiatry for us. Podiatry has grown a huge amount because it's a class 4 laser. So you can go all the way down to a class 3B, but you can also go to a higher level and treat things quicker and more effectively in a shorter treatment time. But it also allows you with a little tip to do surgery with it. So you can do ingrowing toenails and onychomycosis and verrucas. Hence, it's a very big dual purpose laser on the podiatry side. But for yourself in physiotherapy and for most of the practitioners I'm dealing with on osteo and chiropractic, we use it as a therapeutic laser. And we've got proof on the depth of penetration. So we know we can go down to about 15 centimeters, which is unusual. And we can do that in a short treatment time. So it fits in with a good clinical practice like yours, which is busy. The clinicians are doing multiple things. They're like, oh, why do I need another thing in my clinic? Well, as however good a clinician can do, they can only do so much with their hands and with a sheet to go home with. And more people aren't wanting to be reliant on drugs. And what K-Laser offers them is something that biologically can do a lot of the physiological things that we cannot do with our hands alone. And we can do it both superficially and at depth. So it works really well with manual therapy.
Yeah. Can you expand on that? When I say expand, briefly expand.
Yeah.
And we've got, most people listening to this have got a fairly good level of knowledge when it comes to the human body, the anatomy and physiology. But how does it work at a physiological level then?
It's more complex than a drug, because a drug, obviously, once you found your molecule, the only thing you can really change is the dosage and the amount of times per day or week that you take one. Okay. Yeah. With a laser, it's actually made up of 3 different components. So there's the power aspect, which you don't need a lot of power if you're doing wounds, but in doing hips or backs or shoulders or something osteoarthritis, you need a lot of energy. And the only 2 ways around that is you have a lot of time, which most people don't in our lives these days. You have something which safely delivers a lot of energy in a short time frame, which is what our laser can do. Okay. The other thing it does is it uses wavelengths, and wavelengths target specific molecules in the body. So it targets hemoglobin in the skin. It targets water for circulation, lymphatic drainage. It targets oxyhemoglobin for dissociation of oxygen and dumping it where it may not be being provided at high enough levels. But it also targets the cytochrome C. So cytochrome C is in every cell in our body. The challenge is, can you get deep enough into the cartilage, to the bone cells, into the deep tendons, musculoskeletal, and do it so that it actually raises the metabolism. And it's no good just raising metabolism, because we need the other things of increased circulation, lymphatic drainage, and oxygen to allow all the nutrients and to allow the oxygen and to allow that whole ecosystem to improve what we can do by raising the temperature, raising the bar in regards to metabolism. And that's why it works in unison. So there's 4 wavelengths, and it does 4 separate things, both superficially and deep. And then the final, thing just to confuse people a little bit, is the laser can be on continuous, which is great for blood circulation and for wounds or antimicrobial, but it can pulse. And things like soft tissues need high pulsing to optimize their regeneration, where bones are a bit more sluggish and they can't take so much energy. So there is a bit more slow pulsing on bones and cartilage. So there's different things. So when we treat a joint, our laser's pre-calibrated to do 11 phases to try and optimize each of the cell lines, where if we're only doing superficial tendons or something, we may only be doing 5 or 6 or 7 phases, and it's all high pulsing to go and optimize the tendon healing. So it depends.
Wow. So when clinicians start using this, what are the key clinical benefits the practitioners notice most when they start using K-laser in their treatment?
So if you noticed, I only spoke about the biology, about what goes on there, because realistically, it's not like a non-steroidal or a steroid knocking out pain.
Yeah.
What it does is improves the area. So say someone's come in with a contusion of their knee, their big swelling, an acute injury. Because it's so good at lymphatic drainage and stabilizing the cells and getting rid of that swelling, a lot of the pain mechanoreceptors is reduced. So the person is less painful and it allows that tissue to start healing more rapidly. So with a big bruise or a really bad swelling on the knee or the ankle, can bring that down very rapidly. Conversely, on the opposite scale, where you're talking about some of the neuropathic pains or the osteoarthritis, you can work locally or on the spine, and you can help those cells on reducing some of the pain and inflammation by stabilizing in the joint some of the inflammatories and making it a nicer environment. So it's less antagonistic of the nerve endings. Whilst if you really have someone with a neurological problem, you have to be realistic. You're going to treat them maybe 10, 12 sessions, but you can actually stimulate the nerve cells to form new junctions and more dendritic outgrowths. So you can actually get them to go and have both a motor function improvement, but also a new pain pathway, so that someone who's got fibromyalgia or a peripheral neuropathy, you can start to make them feel actually better and better sensation.
That's incredible. So there's so many ways then that clinicians can use this within their clinical practice.
Yeah.
There seems to be a big movement lately away from hands-on treatment as much. When I qualified, it was all very much you spend the entire time with your hands on the patient. And the more and more new clinicians we get coming through, my younger ones, they very much have a balance now, which is great. So for the younger ones that are very rehab-based, they want to get them in the gym, they want them to be loading and deload and then reload tendons and all these things that we're hearing all the time. How do you see it working with that? Can that happen sooner and quicker because of healing happening quicker?
So there's 2 things I can answer there. Interestingly, in America, they're always interested in the bottom dollar, but also the longevity of how they can treat people. And actually, the reason K-laser grew so quickly was because they were protecting their hands. Not everything needs full-on massage to get the results they're wanting. And sometimes K-laser can help them a lot with that side of things. So in America, the massive growth was 1, profit, but 2, can I preserve my body as long as possible so I can stay a clinician for as long as possible, okay? So for the new generation and for the old generation, K-laser can allow you not to take away anything that you do and any of the training that you do, but it does protect your body a little bit, because you get it when you're really trying to do a thigh, or that you're limited in regards to what you can do on a back with your hands in some respects. It allows you to go and penetrate down there, and it helps you, but biologically it's going to go and work in unison with all your great training on the biology, the physiology, but more importantly, understanding the pathology about what you're trying to treat. Sure. Because there is different protocols on the machine depending on whether it's an acute, chronic, soft tissue, bone, old, or all those sort of scenarios. So it does work in unison with a good clinician who understands what they're trying to treat. And therefore it would work alongside a sports therapist. We've got them in the Premiership clubs, where you're going to get no better compliant person than someone who's gone and torn their Achilles and wants to be back in a very short season on that pitch again. They can be treated twice a day. Most of us don't have that luxury in practice of having someone coming twice a day to us. So the majority of the times there's a compromise in how frequently we can treat them. So usually once or twice a week is what we're able to get them in for. Someone who's motivated for an acute injury could come in daily if they really wanted to, but it's very difficult to get people in that frequently. but we know that from our results that twice a week is sufficient.
Yeah.
And then it will combine with both massage therapy, with all of that structured program if they're going and doing a program for the gym to build up the muscles. The biggest thing that a clinician has to be scared about is not over getting the client to do too much, because there will be an analgesic effect. If you reduce the swelling, if you start working on the spine, they will think they're better than they actually are. Okay. And I'm an honorary laser clinician at Guy's and Thomas's, and we set up the hand therapy unit there. And they've got about 9 plastic surgeons, and they've got about 22 physios and occupational therapists, and they've got a number of our machines there. And the problem was a lot of these people who had really bad hand problems started feeling much better, but their body hadn't physically healed yet.
Yeah.
And so you almost need to hold them back a bit and really read them the riot act that the analgesic they're going to feel is not quite how the body is healing, especially tendon and ligaments.
Yeah.
And they need to go and not spend the whole weekend gardening when they feel better, but actually go and just restrain a little bit and bit by bit. And so this is where it works so well with your new generation of sports therapists and physios, where you're trying to help the client understand that this is a process to get through. We can concertina that and we can improve the quality of the healing, but they mustn't mistake analgesia with healing. Those 2 different things.
Yeah, that's fascinating. And I guess in the first remark, when you said we can concertina the effect of healing, we can make things happen quicker. First part, you think, how do we make any money by doing this? If we're getting people quicker and faster, how do we see the return on investment? So you've got 500 machines across lots of clinics now. What patterns have you seen in terms of return on investment when laser is integrated really well with the clinic's treatment offering?
No. I've had a clinic that said this is too good. It's going to actually, it's going to. We're not buying it because it's actually healing patients too well. So there was a client that actually said that to me. Okay, my opinion is, and from the majority of the people out there, that we come into this to get people better. And you and your fantastic Thrive group know that there's nothing better than the word of mouth. We can spend a lot on social media. We can do as many things as possible. But if you've got a good clinician, you've got a good system, and then you've got good medical devices, that differentiates you. And that client who may have seen 3 or 4 other practices before they ended up with you guys suddenly realize that they're onto something really good. And more importantly, especially something like osteoarthritis, you're not curing osteoarthritis, but you're improving the quality of it. So you may manage their drugs better, reduce that. It's a lifetime management of those cases. So you're not just discarding them, but you're creating something where they are genuinely healthier and better out of it, but realistic enough to realize that you're not curing osteoarthritis. With musculoskeletal things, hopefully you are going to get them back to the level that they were prior to the injury. Sometimes not, major surgery and things like that, but at least you're going to get their quality of the healing and the scarring much better than it would have been. And those people will talk. They will genuinely be in awe of what's happened to them. And there is nothing better than them talking to their neighbor, talking to their friends, talking to the family, and they will become your next customers. So you're not discarding people, you're actually gaining people. It becomes a little bit like the gospel. You start going and getting people to talk about it more. And outside of my clinic, I've got 2 big billboards with Indiba on one and K-Laser on the other. And I would say 60% of our clients come in because they see those boards. And then they become first-time clients, and then we go and work with them. And some of them are short-term clients. Some of them are going to be long-term because of the condition that they have. But that's all good for the business.
You can charge more, clearly, if you're using
absolutely
these devices. You get outcomes.
Some of your audience may be rich enough and wealthy enough that they may have a problem with their tax bill. That's a nice problem to have. So they can obviously buy capital equipment and it zeroes their tax bills and things up to 250,000 a year, which is quite a big number. But so the government wants you to invest in things, but most people buy it through lease options. And a lease option is a very good way of reducing that bill over 3, 4, 5 years, whatever your budget wants. You can put a deposit down if you feel you need to reduce that. But that means it generally costs you about between 10 to 15 pounds a working day. Okay. That means you can make profit from day one. You only need to do 1 treatment a day and you've made profit with that. As long as you either there's two models, as long as you're either getting the footfall in and it's increasing your compliance and your footfall, or you decide to go and raise the price and add a bonus of whatever you feel is worth your time, because most K-laser treatments are taking you about 15 minutes. So if that's taking you 15 minutes away from doing your physio, you need to value and charge for that time appropriately. So your clients are the length and breadth of this client country. Not surprisingly, there is socioeconomic differences in regards to what they feel that they can charge, depending on where they are, and depending on what they are in regards of a physio, sports therapist, osteo, all will be charging slightly differently. So I tell them what do you charge an hour of your time? What do you value that? And then divide it into a quarter. And that's really what you'll be charging for a session of K-laser, whether it's with your existing hour treatment or out with it. Because a lot of the times, because of the compliance things, we're often getting clients coming back for follow-on treatments of K-laser where they may not get the full massage therapy or the full physiotherapy. So once a week, they may be having that, but twice a week, including that initial session, they'll be having the K-laser.
And the clinics that you've seen make this work, have they put this as a package so you're not just buying a one-off session? Because we know that's not going to be effective.
Yeah, very much, Katie. Often to get them through the door and to get them to choose it, they might want to go and do some enticement. So in our practice, we do, rightly or wrongly, we're a new practice here. So we said it would do a 50% discount on that first one.
Yeah.
So that, because they're like, really? Are you sure we need to do this? Is this really going to make a difference? And just to get them to feel a difference, sometimes you need to do something like that.
Sure.
But thereafter, we do packages of 4 sessions or 8 sessions, and there's a slight discount when they buy them up front and do a bundle discount. But I might have had in a year 2 patients who didn't buy the bundle afterwards, having had one session. After that one thing, obviously, if it's an acute injury or they really don't feel they could spend too much in one go, then you can book them for 4 sessions. But most people with a chronic problem often sign up for 8 sessions. I had one lady who bought 24 sessions for her and her girlfriend. And so the two of them come along and they have regular sessions just to maintain their bodies in a status quo, along with massage therapy.
Wow. So there's so many ways that you can use it alongside what you're already doing within your clinic. We talk about packages and ensuring that you're focusing on what the client needs to get the outcome that they're looking for, rather than your money mindset being the thing that gets in the way with charging and pricing.
Absolutely.
How you found that actually having a hook to get people in can help?
The billboards and advertising help as well. It's interestingly in Europe, I know we're talking K-laser, but Indiba is a very big brand.
Yeah.
And so just by advertising Indiba, we get a massive amount of Italians and Spanish and French coming in because they know the brand. So that's quite interesting in its own right.
Yeah.
K-lasers, your audience, if they have horses, will know K-laser. If they have dogs, like you just talked about, they'll know K-laser because most top clinics will have it. We have every single university in the country using it. So it's a very big product in that thing. Increasingly, the NHS, some of the Guys and Thomases, the North Tees, other Kingstons, these hospitals are using it for rehabilitation, or in some cases, they're using it for diabetic wounds, to heal diabetic wounds. So the podiatry side of it can be very useful, or venous ulcers and things like that. So it's quite broad spectrum. Each of the areas requires specialist training. So we can train them on site, and we usually do a trial. But we also have the academy here where they can get really good level of training targeted, whether they're a podiatrist, a sports therapist, physio, osteo, chiro. So we can target that accordingly. So it's their language and their clients that we're talking about, and using the protocol specifically to help them along that journey. We didn't speak about profitability, but by far the most profitable is podiatry, because that high energy head means that you can start treating verrucas, onychomycosis, and ingrowing toenails, which is massive. And so one piece of equipment allows you to do all of those things. And we just published a paper from podiatrists in the Royal College of Podiatry using the ingrowing toenail surgery. So that got published this year. A number of things like that.
And am I right in thinking that, is there a use for this in women's health?
Yeah, and obviously from your own background, I know your clinic in Sheffield's very interested in that area. It wasn't something we set out to do, but we had a clinician in London who was already doing a little bit with class 3B lasers. and she was not getting the results she quite wanted, but not bad. Yeah. And then we convinced her to take the K-laser, and now on Harley Street, she's now been taken over by a regenerative medicine company. So they combine regenerative medicine for women's health and the hormonal treatment along with K-laser. And they've seen a phenomenal increase in egg production, but they've also gone and seen things in regards of, unfortunately, after cesarean sections and things, the scarring and pudendal pain and things like that. And so there's also used for that area as well. So it's used for boosting egg production and getting the fallopian tubes and everything working, but also used on an anti-inflammatory and an analgesic effect for some men, but predominantly women who have pudendal pain and pelvic pain. And the fact that we can penetrate down there and do it in a beautifully non-invasive way means that it makes, in some people we've dealt with, I'm afraid to say they've been raped. And so the scars internally and externally are very big for those individuals. And anyone touching the pelvis area, it's a very delicate point of area. To have something which is non-invasive and can work with those individuals, it means automatically they're a lot more comfortable. And we may not be able to get rid of the psychological aspects, but we can help internally improve their quality of life.
It's phenomenal what it can do, isn't it?
Yeah, that I have to admit that the big area for us has been musculoskeletal and pain management, and the earlier you use that, the better. But the area of females' health is something that we are very interested in. We published a paper with this lady and showed the increase in egg production of people who'd had years of hormonal without being able to go and get a baby to full term. So that was great in itself. And I think some of the internal scarring aspects is really interesting as well, because I think a third of the women in this country have cesarean sections now, and therefore there is inevitably, the moment you cut, you create scarring. One of the areas which we haven't gone into, which I'm interested in the future, is obviously a lot of the gut problems that people get, because if you have IBD or IBS, you do get the scarring as well. And I'll be interested to see in the future, if we did research on that, whether we can reduce some of that and improve some of the motility and pain that's associated with those, but we haven't gone into that scientifically at all.
And Dr. Stephen, we've got loads of clinicians, we've got a big cohort of women's health, pelvic health physios that listen to this, we've got podiatrists that listen to this. One of the things that we co-hosted a webinar together, didn't we, about the return on investment and how you would, from a business point of view, plan for investing in a machine like this and ensure that you get your return and all the things that you need to. What would be somebody's first step? So many of us listening to this podcast are visionaries. We're shiny object syndrome people. We are instantly at the Foot and Ankle Show or the Therapy Expo wanting to buy. What do you think should be somebody's first step if they are really interested in bringing something like this, a medical device, into their business?
I mean, you'll have the whole spectrum. Admittedly, you're a group within the Thrive are that sort of peak of individuals who are fascinated about doing their medical manual therapy careers and business, which used to be a dirty word in the UK, but shouldn't be, because all of us are actually, our taxes paying for this country, our small businesses. We're doing a great job. So we should be really proud, one, of what we're doing medically, and two, what we're doing financially. And those should be working in unison, not in isolation. From a person going into this, we often go, oh my God, that's the price of a car. And they're right, it is. But a car devalues. We're only going to bring value to you. So from day one, our product is going to bring more money, it will bring more footfall, and it will, more importantly, it will give, you can't all be the leaders of a pack, okay? But it will empower some of your staff, and especially you mentioned some of the younger members coming in from the profession who are maybe, dare I say, a little bit more open-minded and more eager to try new things. And I think more and more training now is looking at first opinion papers. So they're wanting the science to prove that it works, but they also want to do things which can improve what they can give to a client. And especially if you're, for instance, if you're a new practice, you've started up, it's a pretty scary world. Hats off for you for starting up a clinic. But when you start up, first of all, you do need some differentiation as well. And actually that clinic that you're setting up down the road is established and they've got a great relationship with clients. So why are you different? What are you doing to go and improve the quality of the health of your clients? So investing in a piece of equipment like K-Laser differentiates you. It gives you something the clients are going to walk away with and talk about, and it improves your quality of healing and what you're able to provide. So all of those things is good business, but good science in regards to what you're trying to do for your patients. And more importantly, and this is where I think the universities are rubbish at doing and things, so this is why your Thrive does such a great job. We're still not taught in universities at any medical level on economics. How do I get paid, and who pays taxes for me? And what does that consult cost mean in regards of what's going on in regards to the whole business? I want to be paid 30,000 a year, whatever you want to be paid. But how does that translate from the person walking through the door? And all those things are important. And so what a K Laser can do, through which we were never taught about, is through lease options and through hire purchase. You can buy a piece of top equipment that really helps you. And actually, it doesn't cost the world. It's spread over like a mortgage or lease for a car over a number of years. And then you even forget about the payment, because actually you're charging appropriately. You're getting new customers through the door. You're increasing your clinical options. And on all things, those are a positive benefit for your clinic and your patients and for your balance sheet. So, yeah.
So it's a win-win. What excites you most about the future of laser therapy in the health and wellness market, and what's happening and what's changing?
I don't think it's just laser. I just think I think people are getting more grown up in health in general. And I think our clients are driving that as well. I think the general public is so much more aware of health and not happy for second standards. And so I think that's being driven from the bottom up as well. It's from us, what we're being taught. I'm still disappointed at universities how they do not seem to be talking about really good equipment in this day and age. It's an anathema to me that they should be talking about. It should be happening now. They should be coming to us, not us begging to go and come to them. And so the next generation should already be functional. I employed a level 7 sports therapist. He wasn't given any training about this. And after working with me for a year, he decided to do his final dissertation on K-laser because he couldn't believe that's how much they should be talking about it. And yeah, I just think for the generations coming forward, this multimodal use of things, it's not taking away good drugs. There are amazing drugs out there, but none of us want to be on the highest drug or adding in more and more painkillers to get better. Good therapist with good understanding and knowledge and good idea, all of that side of things is important. And it's combining all of this, because the beauty about, from your background as a physiotherapist or an osteopath or sports therapist, is you actually spend a long time with the client.
Yeah.
And you have to be a good social person to be able to be a good clinician to be able to do that. But that means a lot of time talking about it. And a lot of the time, it's not just talking about what you can do. It's, you know what, maybe we need to send you off to go and get good diagnostics because we've done 4 sessions. And it's combining all of this in an ecosystem where the center of it is our patients. But out of that, we should get a lot more satisfaction, because there's nothing better than getting a patient better and improving their quality of life, because they may be the dependent person for the family and they're all dependent on them. So them not working and them not being able to do things has a knock-on effect on all the people we never see. Or just the fact that just because you've got osteoarthritis doesn't mean that's you not able to walk for the rest of your life. You should be as independent as possible for as long as you possibly can. So that's important as well.
Like, and with what we're seeing happen in the NHS and the drive towards more people being treated in the private community, there's no better time.
All of my family are NHS, and there's never enough money. We just watch the budget, and it's eye-watering amounts of money that's being spent on it. It dwarfs Social Security, and NHS budget dwarfs any other department several times over. And I don't see an option. We've seen, and sadly, you and I have been around long enough to see many governments now, and I don't see a change. I don't see how you can fix that. And for those of us who are fortunate enough to have private healthcare, fantastic. But even then, there's waiting lists on that now. I see private healthcare as being an integral part of our nation's health.
Yeah.
And the fact that private healthcare, physios, osteos, sports therapists, podiatrists spend so long with their clients means that there is a lot of dialogue and talking not just about what we're doing there, but about their whole health as well. And you hear about their family as well and everything. So you can't be a good clinician without doing that, because you need to find all of that. But also being able, what I like about my veterinary profession is we've got a great relation with the referral business and the non-referral. And we can't all have X-rays and MRIs and all these other great tools, but we should have the access to be able to send someone to it when we put our hands up and go, you know what? There's something else going on here, and I think you need to go. We need to understand what's going on before we start doing all the treatment. And I think that's quite a big skill set that we need to be able to treat things properly.
So if people want to continue this conversation and they might have been thinking about bringing in a medical device or medical technology into their clinics, they have maybe met you at an exhibition. I know I met your colleague Antonella at the Foot and Ankle Show.
Yeah.
Or they've been to Therapy Expo. They've had they've started to have these thoughts about what's next. And hopefully, if they've been listening to this podcast, they're thinking about how they plan for it, how they budget for it. What does that business plan look like? How do they continue this conversation with you, Stephen?
So my company is called VBS Medical. So you can find it at vbsmedical.com or klaseruk.co.uk. So those are the two websites that are platforms. Yeah. I have a great team. They try and keep me away from them these days. I used to be on the field all the time, but I do less and less of that. And I decided from the beginning that I didn't want a team where one person comes in and tries to sell you, one person comes in and tries to train you, one person does the installation. So my team is judged on the whole process. So they're there from the beginning. And the reason we sell again and again to existing clients is because of that enduring relationship, that we have brought them new money, we have brought them new skill sets and new ways to help, but that continuity in the salesperson is really important. Yes. It's not just about having good equipment, it's about making sure that we're a good partner as well. And so that whether it's Derek on the south or Natasha, or we've just taken on a new guy who's an ex-Everton physio podiatrist, Everton FC, you're followed through that whole process. And yes, I might get involved, or yes, Antonella, our trainer, might get involved. But your point of contact is that salesperson, so that they can take you through it. And you might have new staff, or you might expand to a new thing, but you want to have that person to be able to take you through that and get you that equipment and make sure that if there is a problem or something is not quite right, you can turn to someone straight away and have that backup. Yeah. And that's important. We're not a huge team, but we're an experienced, and most of us have worked with this for multiple years.
Yeah. And that's what really struck me when I first met Antonella, was that level of experience that you'd all got and level of knowledge. And it was passion. And passion. That was it. It was all about that came over to me more than anything. It wasn't a sales thing. It was all about, we just really want to show you how great this machine is.
Yeah, no, there's nothing gets us more happy than when someone sends us a case study and we're like, oh my God, that's so good. And we shouldn't be surprised, but it's so good when you have a story like, and you're like, and sometimes we talked about how diverse. I think you need to concentrate on a few things and do it well. Absolutely. But you're right. As you get along, it gets wider and wider, the remit and things of what you could do. Or in your clinic, you have female health and physio and MSK and all those things. But there's things that we get back, and we have WhatsApp groups, which are all the clinicians of podiatry and all the clinicians of aesthetics, for instance, or all the clinicians working in MSK. And some of the things on there are great. And it's not just us giving ideas now, it's other people who sometimes might have done more in that area. For instance, up in Lancashire, there's a place called the Sanctuary of Healing that treats MS patients. And they have a number of RK lasers. And it's become a fundamental thing in rewiring some of those patients and getting their musculoskeletal systems working a lot better. Wow. And so you're reading some of these things, and I'm in awe of listening to some of these stories. And so it's really nice getting that two-way interaction. And we learn stuff every single day, even though I've done it for 15 years. And I think that's how we should be in life. I think we get bored in life if we aren't learning things every day.
Absolutely. Yeah. And this is such a fascinating conversation. I could continue it for ages. We're going to make sure that the websites and ways of contacting you and your team, or your team, are on the show notes. So if you're listening to this, head to the show notes and all those will be listed there. And I don't know if it's you, Dr. Stephen, but you're going to be at some of our Thrive events coming up.
In October.
So members can come and talk to you.
Yeah, I'm looking forward to it.
Very excited about. Be prepared for it to be very loud and very energetic. I don't think You're quite ready for it.
No, Katie, I'd expect nothing less.
And sequins, there's always some sequins going on. You don't have to wear them.
I'm not sure I'll be in sequence, but yeah.
That'll be my mission.
Yeah.
Dr. Stephen, thank you. It's been an absolute pleasure. Thank you for giving up your time.
No, I appreciate that. And that was a lovely little conversation. So thank you. And thanks to the audience for listening to this.